to med surge, be careful so the water don't fall on it. I will not be responsible. That's why y'all gotta put it on there, right? Med surge is the disease of the adult, right? Med surge. So we are on page 877, medication, be quiet, we started, and page 854, disease. So you're going to take a pen, right? A pen, and we're gonna do the drugs and the disease. So I'll tell you last week where I stopped off. Okay, 877 and 854. Okay, right? Okay, so 854, 856, where I'm going to start with you, and the drugs, we stopped on Cochaline, Alpirinol, we stopped on 878, and we did 879, which I can recap, I don't mind, okay? $878? Allopurinol, anti-gout. Okay. Shh, I know, that's where I'm at. Remember I said I stopped on anti-gout, right? We are on 878 anti-gout, true? We did Roboxin. Okay. All right, let's go. And then you're going to put the disease, which you're going to start on page 857. So you're going to take a pen to divide the anti-gout, and then you're going to put your hand. The first section we're going to do is injuries. Injuries. All right. Okay, so when we talk about multi-skeletal drugs, right, we're talking about drugs for muscles, muscle spasm, right? You sprain your back, you sprain your ankle. Remember those, right? We talked about those, or the school talked to you about them, right? Okay, so the first category of drugs, the books say anti-gout, but be careful. The drugs are not only for gout. The drugs are to remove or lower uric acid. They are to lower uric acid. Ready? Box 8, page 878, box 59, 2. Right? The first category of drugs I'm going to talk about is what we call allopurinol. Allopurinol, probenecid, cochaline, interin are drugs to remove or decrease uric acid. Uric acid is like calcium. What happens is it goes into your blood and becomes hard and causes gout. Gout is all this garbage that it's in the blood, and it normally goes into the big toe, and you have the big fat toe. What causes the gout? Rich men food. Rich men food like caviar, right? A lot of people say liver causes gout, although liver is not a rich man food, but liver causes gout. Seafood cause a lot of gout because of the purine. Remember sardine. Sardine not a rich man food. Sardine poor people food. has purine in it, and it causes gout. Cranberry juice has purine in it. That's why you see cranberry juice, you put what? Water, because it's very what? Concentrated. Prune juice cause gout, have a lot of purines in it. When them prune juice, they put a lot of water. Make sure you guys know that. So we give you these medication to lower the uric acid that causes gout. Now, when you give this medication, it is help to decrease gout, decrease uric acid that causes gout, but causes kidney stone. That's why anytime you give these drugs, you give it with a lot of water. These drugs cause bleeding, so you will never give a patient who's on Coumadin this drug. You never give this drug with aspirin. You will question this drug for a patient that's taking aspirin. Any question? You do not only give this for gout. Cancer patient take it. Why? When you are on chemo, chemo kills the what? Good cell and the what? Bad cell. So when I give you the chemo, all that garbage goes into the what? Blood. I need to give you a drug to remove all the garbage from the blood. Yobesa. So again, the books say anti-gout. Remember, these drugs are given for uric acid that causes gout. Any question? Sometimes you on dialysis, they give you this. Any question with these medications? So anytime the patient is on it, you ask them, why are you taking this medication for? Now students say, oh, they say you don't ask why in nursing. No, you don't ask why in psych nursing. Okay? Why you say you want to kill yourself? You don't ask psych patient why. But a med-surg patient, Miss Marie, why are you taking Cochaline? Wow. You got it? Any question?
Miss Sonia,
yes.
This drug is not given with the aspirin, right?
No, you don't give with aspirin because the drug makes you bleed. So if the drug makes you bleed, you give me aspirin on top. I'm going to what? Here's another NCLEX question. Anytime you give this drug, you check PTT. Why? The drug causes bleeding. H&H. Why? The drug causes bleeding. Any question? Okay, so the reading for this is page 878. 2, description A, B, C. Right? Nursing consideration, D, 1, 2, 3, 4. Okay, so you need to read that. You need to read brand and generic and class. NCLEX kabo brand, you kabo generic, or you buy class. They can say anti-gout. They can put anti-uric acid. You see, whatever they want, you cannot say, well, I didn't study. You got to go study, right? Okay, then we go into anti-arthritic. Lie, don't put that. Don't put an X on anti-arthritic. Or put, these drugs are used for arthritis plus. I want you to put plus. Page 878, the box 59-3. Guys, these drugs are not only given for arthritis. Let me tell you what they're given for. And y'all, you're going to see a lot of them on TV. Arthritis, psoriasis, when you have AIDS, when you immune suppress. You with me? When you on chemo, we give you these drugs. Again, these drugs are not only given for arthritis. When you have lupus, wait, so I want you to say these drugs are given for autoimmune disorders. Okay? The first drug we're going to talk about, Humira. How big TV commercial that is. Every 6 o'clock, I see a Humira commercial. Immurun, how big that is on TV. Very big. There go it in Braille. Top 200 in Braille. Onesa. Top 200. Ready? Nurel. My old student. Where did I teach you Immurun, Nurel, Celsat? Old student. Old student. Renal. And what else? Cancer. And what else? Immune. Anytime you have chemo, we give you Immurun, Nurel, Prograph, kidney transplant. So I give her a transplant. I give her a kidney, and I don't want her body to reject it. I give her immune suppressors. Immune suppressors are used for multiple things. Arthritis. Arthritis. Let me talk to you about arthritis. They call arthritis a connective tissue disorder. They call lupus a connective tissue disorder. What do they mean about connective tissue? You have this disease, you got a fever, and the fever has nothing to do with infection. You see, when you have arthritis, you got a fever so high. But I go check your WBC, it has nothing to do with an infection. Those are called immune suppressed disorders. You got that? So we give Enbrel, we give Humira, right? We give Nurel. We give it, which you'll see renal, right? Cell sap, right? In here. Cell in Nurel, in Braille. Trexol. You see that Rumotrax? LPNs who are licensed LPNs. Methotrexate. Who do you give it to? LPNs. Who do you give it to? LPN. What is that? LPN. Who's a licensed practical nurse? Meaning you work. Let me ask you a question. Who do you give methotrexate to? Postpartum. Who do you as the LPN give it to? Older people with what? Older people with what?
What?
Older people who cannot eat, like chemo, AIDS, right? Kechatic, shesh, mag, right? You give it to them. These drugs, this methotrexate is what we call a folic acid antagonist. After you have an abortion, remember, an abortion can be miscarriage, that's the pretty name. It can be voluntary, meaning you go to a clinic or you lose the baby. Anytime you had an abortion, they clean you. Anytime you're on chemo, chemo is cleaning the blood. We have to give you a drug to fix the cell, and they call methotrexate a folic acid antagonist. So we give it to chemo patient, right? Nou bay moun ki gen lupus, ou bay moun ki gen sida, people who bay mouri on pied dehors, people who about to die, right? You give it after an abortion, you give it because to replenish the cell. That's why anytime somebody taking these drugs, you okay, baby? Yes. Oh, baby. You ask them, why are you taking this drug for? You got it? Because you can use it for several reasons. You got it? Any question? These drugs are given to help your immune, but cause your immune to go down. So as the nurse, you must isolate neutropenic precaution. No fresh flowers. No raw meat. no standing water. You will dress standard precaution like you're going to the moon. Why? Because whoever on it, they immune already what? Low. That's why I told you, you don't go. Now, they use for arthritis too. Arthritis disease is a disease connective tissue. Lupus, connective tissue disorder. Any question? Yes.
I don't understand why it's saying it's a antagonist, folic acid antagonist.
Yes. Is a folic acid antagonist. Antagonist is against. What it is cell division. Anytime consumes you on PT, right, for example, we need, when you have cancer, the cells in your body, we need to replenish them again. So that's why you give this drug. It's a cell replenisher. Now, what is the psychokinetics, the pharmacokinetics, is folic acid. And it's on page 240 in your book, right? And we use it for patients who have ectopic pregnancy. So after we clean you, to replenish the what? The cell. Okay? Yes.
But they have your immune system too.
Huh? Also, listen, it's supposed to boost your immune system, but it make it weak. Like you easy, c'est pas you easy kamala. So the reason I'm initiating neutropenic because I want to protect you from me, the nurse. Any question? So anytime the patient is on this, you're going to ask, Carol, why are you taking it? Now, let's talk about different form of it. Ready? Turn. I'm on page 880. You're going to get it starting on number 5. 880. 880, number 5. First of all, get your pencil, and I want you to check what I want you to read, and I'm going to go over. Check number 5. And I'm going to talk about it. Q880, number 5. Check. Number 6. Check. Number 8. Check. Number 9. Check. Number 10. Check. Number 11. Not all of them. And check number 13, and I'm going to talk about it. Oi, listen, mon yo mette, pa met sel, pa met citron, pa lave, just li samdou li yo, be li swan li. Only read what I ask you to read. The numbers that I want you to read are the top 200 drugs. Again, number 5. I said number 6, but I don't even care for it. Number 7, and I'm going to tell you why. There's a name they call number 7. Number 8. Number 9. Number 10. Number 11. Number 13. Now let me go over them. Number 5. Number 1 asked NCLEX question. Humira. Humira comes in a couple of forms. A PK, that's mean injection. If the patient have arthritis, they will stick the person there. If the patient has psoriasis, they will put it on the skin. Again, it comes in cream or it comes in injection. PK. It never comes in PO. It comes in PK or cream. Any question? You got it? Because I get students all the time on my mama, papa. I just stood here and tell you it comes in injection. When you stick the patient, because ipudule, right? So they stick the patient. Sometimes they ask you, when would you call the doctor? When you see the patient say, I cannot move after I stick them. After you stick them, you're always going to see a little swelling. a little swelling, but not what the patient say, I cannot move. So NCLEX asks you, after you give Humira, what is your initial nursing assessment? Check for compartment syndrome. Compartment syndrome. Stay with me. Wet, look, injection site are common. Numbness, tingling, dizziness. When would you call the doctor? The patient say, after you injected, the patient say, I cannot walk. I feel dizzy. That is an adverse effect. But you got to be careful. The patient say, my hand's swollen. Remember, it's a shot. So, of course, your hand could be a little swollen. But the patient say, I can't move. Or the patient say, turn blue. What is that called? Compartment. The problem with students, the students think compartment syndrome only happens with CAS. Be careful. Compartment syndrome is I cannot move it. You checking for pulse, you don't what? Feel it. That's a medical. All right. Any question? Okay, Nanali. Okay. Number 6 and 7. You remember at school, they told you that arthritis medication, sometimes called gold something, G-O-L-D. These are the drugs they call gold drugs. Anytime they talk about like gold chain, that tell you that has to do with arthritis. That's why I want you to know these drugs. Not because it's a top 200. Sometimes they don't put the drug. You may take gold something. Right when you see gold, it has to do with what? Arthritis. Another word they use for arthritis drugs, they say DMARDs. You may take DMARDs. If you student a little bit, DMARD, or they say gold something. I don't even remember gold. Anytime you see this, that tell you arthritis. Any question? No more? Okay. Now, then we go into Imuron. Top 200. Imuron is for arthritis, AIDS, cancer, lupus. They're immune suppressor drugs. So if I give Carol my kidney to prevent her body from rejecting it, I give this drug. Guess what? I'm going to initiate neutropenia. I'm going to put her on bleeding precaution because these drugs, something called blood disgraces. Blood disgraces means if a WB tombe and platelet drop. So NCLEX say you give an Imuron. Which one you will not do? You will not give suppository because the patient at risk for what? Bleeding. So you give an Imuron. You will check WBC, platelet, WBC, platelet, H&H. Which assessment is priority? Blood pressure. Because what? That tell you the patient is bleeding inside. And that's what y'all take. I said, you give an Imuron, which assessment so that you'll check temperature. Boy, it's understood that the drug make your WBC what? Then why you go tell me go check WBC? And guess what? One of the choices. WBC, and you go, you got it wrong. Just like I asked you. You give an ACE inhibitor. What's priority? You tell me, check BP. Boy, the people already know. You know that. So when you gave ACE inhibitor, what's priority? Cough? No, cough is a side effect. What do ACE inhibitor cause? Respiratory? I'm going to throw you out. That's beta blocker. What is ACE inhibitor known for? Potassium, wrong. ACE inhibitor, potassium, try sugar. Anytime you give ACE inhibitor, you must check the patient's sugar. That's why diabetic patients who have blood pressure, I'm going to give you beta blocker and metformin. I will never give you an ACE inhibitor and metformin. Ou est comprendre? Problème student to you. Pas comprendre. Why would you tell me ACE inhibitor destroy potassium?
Because they said NCEN, I use some NCEN inhibitor, and that cause your electrolyte. That's the same thing. That's why I say that.
Oh, no. When I taught you, ACE, listen. All blood pressure medication, stand with me, all blood pressure medication, make your heart rate go low, make your BP go low. They all have that in common. Anytime NCLEX want to do a specific one, they looking for a specific answer. If I say beta blocker, metoprolol, you cannot tell me heart rate and BP. You have to own ça. Respiratory. You understand what I'm, there's an understanding. If I say, all blood pressure medication, you gonna tell me heart rate, BP, lady. I got you. You're right. Kudos. But if I give you specific name, I am looking for something. I am looking for something that each specific about that drug. Anytime you take beta blocker, respiratory, lock the door, the patient hallucinate, right? Commit suicide. Anytime you take an ACE inhibitor, it loses taste in your mouth. Food don't taste good. It make your sugar go low. It make you have a cough. Calcium channel blocker, it makes you enflé comme boule. So anytime you give calcium channel blocker, you must assess the lung. Why did I not say BP, heart rate for all of them? Because NCLEX no, Pearson no. Anytime you give blood pressure medication, the answer is check what? BP, check heart rate. They don't want that from you. They want to know, do you understand each particular drug? Any question? Make critical thinking when you have Monday. Entre tout petit, right? Sou gen base, ou entre ou pousse porte nou bien fort, but sou pa gen base, just tip it toe in. It's called critical thinking. All right? And you will take BP because that's what you learn in school. Stay away from the norm. Stay away from the norm. All Haitian, what is our main food? Griot. That's not true. Some people like turkey. Some people like, you see? But all our main entree griot. That's not true. All Jamaicans, what their main entree? Curry. That jerk. That's not true. You see that? So if I ask you ACE inhibitor, you tell me low heart rate, check BP. I already know that. Stay away from the norm. You got it? Some of you guys feel me. In the heat. Ready? Any question? Let's continue. In Braille, poses risk for heart failure. You see that? Injection. In Braille is a shot. Okay? Plaquenil. Anytime you want Plaquenil, please check my eyes. Check my eyes. Plaquenil. I told you about that book now. Plaquenil. Check my eyes. Check my eyes. Plaquenil. Check my eyes. And let me explain to you. The patient is on Plaquenil. And the patient start to itch. And the patient is African American. what's the next assessment you will do? The patient start to itch. The patient on Plaquenil start to itch. And the patient, a 30-year-old African American. What's going on with him? Oh, boy, yeah. Come on, people. What happened? I'm on Plaquenil. I'm black and I itch. I'm allergic to it. Of course I'm allergic. I'm itching. What is happening? What's the next assessment you're going to do? Liver. But what you gonna check? I'm African American. Mucus, jaundice, because it affects the liver. Anytime you give Plaquenil, you got to watch what the patient say about the eyes and ask to see if the patient is itching or if the patient is African American. Assess the mucous membrane. Did you see the connection? Who did not see the connection? Has to do with what? Liver. Plaquenil destroy liver. Okay? Plaquenil, check your what? Eyes. You see the connection? Then we go to methotrexate. There you go. When you are on methotrexate, there's a lab you need to do for the patient. And the lab is called ABGs. Respiratory acidosis. Why? Look, read the thing. Look. Why? Because it causes pneumonia. There's another thing it causes. Bone marrow. Now, hint. Who's taking my test tomorrow? What lives in the bone marrow? WBC, RBC, platelets. Anytime you take in methotrexate, you check WBC, RBC, you check platelet, because that drug make the bone marrow depressed. Silent testimonial. Methotrexate is a top 200 drug. Cancer patient on it. SIDA, immune suppressed. More people who dying. You by yourself. When you finish having abortion, when they clean DNC, you're by one. WBC, RBC, platelet. And on my test, I don't put RBC, WBC, I put bone marrow depressed. Sou va comprendre qui sacrete dans bone marrow. I got on rouleau. You are in trouble. Bone marrow, we learned that in leukemia. Bone marrow powers, RBC, WBC, and platelet. Yes, it's ABGs because of the pneumonia. Be careful. The bone marrow depressed don't have nothing to do with ABGs now. You see that? Keep the understanding. You understand? So they tell you, the patient have chemo, and the patient is on methotrexate. Which lab would you question? The one that had the respiratory acidosis. The patient is, or they're saying, what should you see at the bedside? I don't know. Suctioning, trach. You know why? Because the drug caused what? Pneumonia. Any question? You got it? So methotrexate is given for multiple things. The drug caused pneumonia. The drug caused bone marrow depressed. In the bone marrow, you have WBC, RBC, and any question? Who do not understand? Okay. Turn for me. Now you are on not turn. We on page 880. The number one top drugs, and they call them biphosphonates. Biphosphonate. They don't give you phosphomax to treatment on phosphomax. Right? They say biphosphonates. Biphosphonates are 3 drugs. Phosphomax, Boniva, Actonel. Fasomax, Boniva, Actonel. Fasomax, highlight. Boniva, listen. I see a lot of people with that yellow book. Guys, I'm telling you, don't let something say RN, meto na wulo. You better go get this book. I'm telling you, I see a lot of people with that yellow down book, that purple book. You won't be behind. You better go get the green book and stop worrying about prestige. You need to worry about passing. Go get the green book. Y'all wasn't here when Madeline came here last week? What Madeline told y'all? Coûter, acheter, and PN now. Didn't that what? You know Madeline English ain't that right, but she said it in Creole. Go listen. Go get the green book. All right. Okay. Now, let's go. Medication for calcium. Now, before I go into medication, let's talk about what's going on with the disease. Okay, so look. Calcium live in the bone. Shh. Okay, calcium retenance bone nan zo. Calcium sometimes get crazy and it leaves the bone and come to the blood. So calcium is her, right? This is the bone, and calcium is the microphone, and I'm blood. She leave with calcium and come in my house. So it's so much stuff in the house become what? Too full, right? So that's why we give a lot of water. Y'all got it? Because the calcium came where I'm at. I'm already big. She came, now we bigger. So now we need to give water to wash away the calcium. So listen, because the calcium left the bone, she got bone problem and blood problem. Because the kidney not going to work because it's too much calcium in the what? In the blood. So you see, anytime somebody have osteoporosis, you got bone problem and you got kidney problem. Because what happened is the calcium is preventing the kidney for what? Working. So that's why the schools say, give a lot of water. Okay, they gave me water. It worked, but not all that good. So we say, calcium, I need you to go back to the bone. Back. So I'm going to give you a drug called calcitonin. Calcitonin push calcium from the blood back into the bone. Any question? Too bad. Now, when the patient has osteoporosis, right, that means calcium keep leaving the bone, we got to give her some drugs. And the drugs we give is called biphosphonates, right? There's 3 types of biphosphonates, and they all end with nate. Aldronate, tatatanate, 8. Ready? Biphosphonates are your Fasomax, which is called adrenalinate. Then we go to Boniva, which is called abandronate. Then we go to Actonol, which is called resandronate. Do y'all see anything else that end with 8? So that means everything else in that box are not biphosphonates. The only thing that is biphosphonate, you end with a what? 8. On my test, I put, give me all that apply, all the biphosphonate. Student go give me Evista. Do you see a Vista end with 8? Then why you give me stuff so? You don't see a Vista end with 8. Biphosphonates all end with what? 8. So let's look at the 8 again. You see? Fasomax, alendronate, Boniva, ibandronate, Actonel, resandronate. So you got 3 biphosphonates. Okay? So the NCLEX do biphosphonates. Why bon when Evista you in trouble because it's wrong. But you say, I read the book. I read the book, and the book say this is for osteoporosis, Miss Sonia. I got you. But I asked you for biphosphonates. Now, biphosphonates, yes.
So the biphosphonates are the same as the calcitonin?
No, biphosphonates are not calcitonin. Calcitonin is a drug in itself. Calcitonin is used to push the calcium back into the bone from the blood. Biphosphonates are to keep the calcium to stay in the bone. That was a good question she asked, did we? She asked, is calcitonin, biphosphonates are calcitonin? No. Calcitonin is a drug, biphosphonates is a drug. Okay, so these biphosphonates, crazy though. Guys, how can I give you a drug for calcium, for bone, and you cannot walk? If you cannot walk or sit up, you cannot give me biphosphonates. If you cannot walk. Guys, the medication is for bone. How can I give you a medication? You bedridden. So what happened to all the medication? It stayed there, going to affect which organ? The kidney. So anytime a doctor gives you an order for biphosphonate for the patient must be able to sit up and must be able to walk. So you need to question that drug, LPN. Okay? So let's look. Biphosphonates include Fosamax, Actonel, Boniva. Contraindicated. Contraindicated is who cannot take. Mete, who cannot take. Who cannot take? Patient who have swallowing problems. Because the drugs is so big and they only come in pill. If you say, last year I had throat cancer, well, you cannot take it. Who cannot take these drugs? Anybody who cannot swallow, anybody who cannot sit up or walk, you cannot take them. You take them early in the morning with a full glass of water. Okay? And sit up for 30 minutes for Fosamax and Actonol and an hour for Boniva. It's Inuesa. Okay. Now, must be administered with a full glass of water. We talked about that. Adverse effect when you are on it. Esophagitis, inflammation of the esophageal, muscle pain, and eye problem. Anytime I'm taking Fosamax, Boniva, Actonel, I must go check my eye. Anytime the patient say, I got eye problem, guess what? You stop it. You stop the drug. Any question? So everybody know about Fosamax, Boniva, Actonel. Then we go to Avista. Avista is not a biphosphonate, but it is a drug for calcium. But guess what? It is given for bone, but it causes DVT. Anytime you give an Avista, and hardly ever you get the deuterium. The top 200, Fosamax, Boniva, Actonel. That's the 3 drugs. Anytime, excuse me, guys. Hello? Oh my God, yes. Where was I? Okay, Avista. Listen, Avista. The big thing with Avista, it causes DVT. Anytime you give the Avista, you gotta put TED stock in. So NCLEX come ask you how you put the TED stock in. TEDS, T-E-D-T-E-D-S. That's a skill. Okay? Then we go to Forteo. Forteo is a drug that for calcium, but it causes a cancer called multiple myeloma, a bone cancer. Guys, Avista and Fortil is still out there. It's still out there, guys. But don't stay away from them. Because they good for osteo, but they cause more problem. You don't want no cancer. You don't want no DVT, which can cause PE. So, again, the drugs I need you to know, biphosphonates, which are Fosamax, Tonifa, and Tonel. Any question? All right.
Okay, the Fosamax.
Mm-hmm.
I know, you take them daily or weekly?
No. How many they give to you? Not a lot. It's normally you take it weekly. You know that.
Yeah, I know that's
Oh, girl, you know I know that. You give it weekly. Let me tell you what they know, but clear, they give it. The insurance pay 4 a month. 4 a month. You better know that. It look just like a metformin. It big. 4 a month. You give the patient 1 a week. Now, anytime you take steroids, automatically, steroids make your calcium low. They give you that. Not because you got osteoporosis, no. It's because you're...
So some people still don't know, that's why I asked this question.
No, they better know. They better know because the school they paid $40,000. I hope they know. This is a review. You should know Fosamax you give once a week. But you got to understand you are LPN. Everybody else not LPN. So just because you know something, that don't mean everybody else should know it because you got a lot of new students who's CNA. Okay? Any question with the drugs? You must know, and listen, where another thing students get in trouble, you cannot say muscle drugs is for pain. Because if Clemie got pain, I'm going to give her oxycodone. I'm going to give her Demerol. Right? I'm going to give her Vicodin. You got to say these are drugs for muscle spasm, which will help this inflammation that causes pain. Student toujours dit, oh, you give Flexerol for pain. No. You give Flexerol for what? Inflammation that causes pain. All right. Any question? We cool? All right. Let me go into a couple of disease. I know you hot. Bear with me. AC Man say he'll be here before the night. And don't go call your friend and say there's no night class. It is night class. He said he will get it fixed before 6. Because you know students, boy, they'll talk in a minute. Or call me saying stuff I didn't say. Okay, and I led to page 857. We're going to hit the disease. Okay? I feel my skirt coming up. Lord, I don't want it to come up. Okay, I did what got it. Why y'all laugh? See, imagine if I go like this when it's hot. Imagine when the AC on. I go, ooh. So you got to make sure anytime I do a class, go home, go read your book so you can pass. Stop putting stuff off for tomorrow and the next day. All right? So, injuries. Injuries is not a break. Not a break. Fractures is a break. I broke my leg. I fractured. Anytime I say fracture, vle di en Creole, cassé. Break. Break in bone. Injuries. Here it is. I sprain. Right? You strain muscle. not be, how would I say it? You know how you wear a high heel and you twist your ankle? Student D, I strain my ankle. Oh my God, how bad English. I strain my ankle because your ankle is a ligament. Remember in school, they taught you the difference between muscles, right? No? Okay, muscle. You go to the gym, you pull a muscle, you will put ice, 20 minutes on, plus hot, 20 minutes on, and then NSAID. NSAID are your what? Soma, ibuprofen, aspirin. That's for strain.
Sprain, right?
Strain.
Oh, sorry.
Strain. I sprained my ligament. There you go, baby. Rice. Rest. R. Ice. Compression. Compression vle di ace bandage. Mare. Compression. And elevation. Now, here's what NCLEX get you. Oh, bon Dieu. They ask you, the patient sprained her ankle. Which one you do first? You go look for rest. They don't have rest. They put immobilized. The student don't take it. What does immobilized mean?
Rest.
Mais anglais, they put immobilized first. Students say, well, immobilize, bless you, baby. Immobilize now here, I'm not going to take. But rest is another name for immobilize. Immobilize means keep still. Don't move. C'est pas même bagay rest. Same thing. But students say, well, the book say rest, let me go look for rest. Côté, your NCLEX don't give you rest. Then the student say, Gladys, we say that. And she RN now. That the school taught her on NCLEX. She had me on the floor laughing. Any question? Right? Rest, ice, compression, elevation. Which one you gonna do first? Rest. Rest, and then what else? How long you gonna keep ice? 20 minutes. Can I ask you a question? Does ice calme, constrict, or dilate? Constrict. Everybody say constrict? Okay, watch this. Watch. You say constrict. See, it depends on what they give you. Now, you say constrict. Watch this. Watch. If a snake bites you, and I give Clemmy a glass of cold water, and I give her cold water, what happened to the poison? It's going to stay in one spot. It spreads. So it depends on the question if ice going to use as constrict or dilate. If I'm breastfeeding, I put ice to sheshe. You're going to say constrict. All right. Est-ce qu'ils nous comprennent? Ma montée l'argent. Guys, you use constraint, and that it depends on how the people will actually question. You got it, guys? Please understand. That's why anytime a snake bites you, you don't give them coffee, and you don't give them put ice on it because it's going to cause dilation. What you do, you tie it so it can stay in one what? Here you go. So in this case, ice is used as a what? Remember, aspirin. Aspirin. And why are you going to put, because if it's sprain, it's what? It's stiff. So why do you need to put ice on it? To dilate it. Thank you, Jesus. Yes, my baby, yes. Excuse me. Guys, you gotta read to see when it's ice is a constricted method and when it's also what? A dilation method. Yeah, it can be both, but you gotta read to see how. Because if I'm breastfeeding and I don't want to, if I don't want to breastfeed, I want it to dry it, I'm going to put what? Ice. In this language, this is called concentration. Any question? Right? We got that good. Now we go to fractures. Break. Cassé. Cassé. And after I do this, we'll leave. But I want you to go home good. I'm glad Katuska not here because she's so dramatic today. Boy, she would have been like, oh my God, Miss Sonia is so high. Fractures is a break in the bone. Cassé. There's certain fractures, and we'll go through it next week. Good. But we fix fractures 4 ways. Ready? Let's go. Fixation, traction, what else? Cast, what else? Reduction. This one, here's your NCLEX question. It's going to take me 40 minutes on traction. Box, Russell. It's going to take me 40 minutes right here. 40 minutes to do this class, this section. This is where we're going to talk about compartment syndrome. This is reduction. Reduction is what I'm talking to her. I click, 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 click. She came in the ER like this. I talk to her when I'm talking to her. I click, click, click. It's back like that. Now, when you have break in bone, you got to watch to see what type of fracture it is, especially children. Spiral is S, Sonia, S. Spiral, anytime a child come in a fracture like this, but you saw one keep on boy vile, that is abuse. Anytime you see when your mom's spanking you with your baton, what do you do? Right? If I'm going to fall, what do I do? So if I fall and I put my hand, when the bone break, it'll break, which is called green stick. Green stick is the good break in children, the bon Dieu break. Anytime you see a kid have a break, when you go do x-ray, people have abuse. That is called spiral. Right there, call 911. And who can call 911? Who called 911? Hey, come on, laws. We didn't do laws yet. Some old student. Who allowed to call 911 for abuse of a child? The nurse. Who to call 911 or call Board of Nursing if I suspect Rose stole some narcotics? Supervisor. Abuse of children. Gamun. I call you all the nurses. Who called 911 when a nurse came threatening you with a gun? You can call 911. The nurse can call it. There's time the nurse call 911. There's time supervisor call 911. We learned that in fundamental laws when you get there. But old student capquitem, you should know that. But you have no. Oh, you should know that That's très important. That's very important that you know who called the police and when. We will learn that in fundamental laws. Okay, so write this down. Next week, I will finish all multi-skeletal on Wednesday. I promise you. Tomorrow, test. Tomorrow, you are not to bring a book.